Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what narcolepsy is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice. All right, today we're going to dive into narcolepsy. It's a really fascinating and often, really misunderstood neurological condition that just completely throws the body's sleep-wake cycle out of whack. So here's how we're going to break it down. First, we'll cover what narcolepsy actually is. Then we'll look at what's going on in the brain, the biology behind it. After that, we'll go through the 5 main symptoms, talk about how it's diagnosed, look at the best ways to manage and treat it, and finally, we'll wrap up with the key things you really need to remember. Okay, let's start with the big question, what is narcolepsy really? Well, at its very core, narcolepsy is this powerful, overwhelming need to sleep during the day. And I want to be clear, this isn't just feeling a little tired. We're talking about a deep, fundamental breakdown and how the brain controls being awake and being asleep. It's almost like sleep is constantly trying to invade your waking life. Now, even though it has a huge impact on the people who live with it, narcolepsy is actually pretty rare. The evidence points to somewhere between 0.2 and 1.6 people out of every 1,000 in places like Europe, Japan, and the US. And it doesn't discriminate, affecting both men and women equally. It's also a lifelong condition. So it's important to know that we actually classify narcolepsy into 2 main types. You've got type 1, which is caused by low levels of a brain chemical called hypocretin. And this lack of hypocretin leads to a very specific symptom called cataplexy. We'll talk more about that in a minute. Then there's type 2. In this case, hypocretin levels are normal and people don't have cataplexy. Their main issue is that excessive daytime sleepiness. This distinction is absolutely crucial because it really gets to the heart of what's causing some of the most challenging symptoms. And that brings us right to the next big question. What's the actual cause? Let's dig into the science and see if we can unravel this mystery in the brain. So what causes narcolepsy? This is the question that researchers have been working on for years. What is happening on a biological level to cause this complete chaos in the sleep system? Well, the evidence points to this really interesting mix of genetics and environment. See, there's a strong link to specific genetic markers, these things called HLA haplotypes. But it's not just genetic. If it were, identical twins would almost always both have it. But they don't. That tells us something else is at play, some kind of environmental trigger that kicks off the process in people who are already genetically at risk. And the leading theory for what happens next? It's an autoimmune response. Right. So the main idea that scientists agree on is that this is an autoimmune condition. Essentially, the body's immune system gets confused. It mistakenly sees a very specific group of neurons in the brain, in the hypothalamus, as an enemy, and it attacks and destroys them. The problem is, these are the exact cells that produce hypocretin, that critical chemical we need to stay awake. Without those hypocretin signals, the brain's whole system for managing sleep and wakefulness just falls apart. Think of it like a wall breaking down, the wall between different sleep states. Especially REM sleep, the stage where we have vivid dreams and our muscles are temporarily paralyzed. Suddenly, elements of that REM sleep can just leak out and intrude into wakefulness. And that is the key to understanding many of the strange and specific symptoms of narcolepsy. Okay, so what does this REM intrusion actually feel like for a person? Let's go through the 5 core symptoms that really paint the picture of what it's like to live with narcolepsy. First up, and this is the big one for both types, is excessive daytime sleepiness, or EDS. And again, this isn't just being tired. We're talking about sudden, uncontrollable sleep attacks that can happen anytime, anywhere, even in the middle of a conversation or dangerously while driving. A person might take a short nap and feel great for a few minutes, but then that overwhelming sleepiness comes crashing right back. Next, we have cataplexy. Now, this is the defining symptom of type 1. It's a sudden, short-lived loss of muscle tone. But here's the kicker. It's triggered by strong emotions, things like laughing, surprise, or even anger. An attack can be subtle, maybe just a bit of jaw slackness or head nod, or it can be dramatic, causing a person to collapse completely. And what is this? It's a direct intrusion of that muscle paralysis from REM sleep, but while the person is wide awake. Then you have these incredibly vivid hallucinations. There are these intense dreamlike experiences that happen right as you're falling asleep or just as you're waking up. There are technical names for them, hypnagogic and hypnopompic, but what's really happening is another classic example of that REM intrusion. It's literally dreaming while you're still partly awake. You can imagine how unsettling that could be.
And along the same lines, there is sleep paralysis. This is that terrifying feeling of being fully conscious, your mind is awake, but you just can't move a muscle. It happens when your brain wakes up before the body has switched off that natural paralysis from REM sleep. It's yet another example of the wires getting crossed, of REM sleep bleeding into a moment it shouldn't.
And finally, here's a cruel twist. Despite being so sleepy during the day, people with narcolepsy often sleep very poorly at night. Their sleep gets broken up with lots of waking up throughout the night, and of course, not getting good, solid rest at night just makes the daytime sleepiness even worse. It's a really frustrating vicious cycle. So with all these different, sometimes confusing symptoms, how does a doctor figure out for sure that it's narcolepsy? Let's walk through how a diagnosis is actually made. And this is a really important point. Getting a diagnosis can be incredibly difficult. In fact, on average, there's a delay of about 10 years from when symptoms first start to when someone gets the right diagnosis. Think about that. A whole decade. That's because the symptoms, especially in a teenager, can easily be mistaken for laziness or depression or something else entirely. And that delay can have a massive impact on someone's life, on their school, their work, their relationships. Okay, so the actual diagnostic process follows a few key steps. It always starts with a very detailed conversation about the person's symptoms and history. If narcolepsy seems likely, the next step is an overnight sleep study, a polysomnogram. The main goal there is to rule out other sleep problems, like sleep apnea. Then, the very next day, they do a daytime study called the Multiple Sleep Latency Test, or MSLT. This is where they have the person take a series of scheduled naps. And what they're measuring is, 1, how fast you fall asleep, and 2, and this is the critical part, do you go into REM sleep really quickly during those naps? That's a huge biological red flag for narcolepsy. All right, so once the diagnosis is confirmed, what comes next? What are the evidence-based approaches for managing narcolepsy? Let's take a look at the treatment options. The foundation of any good management plan starts with lifestyle changes. Things like keeping a super regular sleep schedule, going to bed and waking up at the same time every single day. Also, building short, strategic naps into the day can be a game changer for managing sleepiness. And for people with cataplexy, it's really important to become aware of and try to manage those big emotional triggers. Now, for a lot of people, lifestyle strategies aren't quite enough, and medication becomes really important. And the approach here is very targeted, based on what symptoms we're trying to treat. For that excessive daytime sleepiness, or EDS, a common starting point are awake-promoting agents like modafinil. There are also newer drugs like solriamfetol that work a bit differently, but aim for the same result. Now, if someone is dealing with both sleepiness and cataplexy, the toolkit gets bigger. A drug called pitolisant can help with both by working on histamine levels in the brain. And then there are the oxybates, which are really effective. They take a different approach entirely. They help make nighttime sleep deeper and more solid. And by doing that, they cut down on both the daytime sleepiness and the cataplexy. Okay, we've gone through a ton of information, so let's just boil it all down to the absolute key takeaways you need to remember. So, what are the big things to remember? Number 1, narcolepsy is most likely an autoimmune disorder where the body destroys those hypocretin cells that keep us awake. Number 2, those 5 core symptoms we talked about, they're all basically just different flavors of REM sleep leaking into waking life. 3, you need proper sleep studies, the overnight one and the daytime one, to get a solid diagnosis. And finally, number 4, treatment is a 2-part punch. Smart lifestyle changes combined with medications that are targeted specifically at the symptoms a person is dealing with. And this leaves us with something really profound to think about. Narcolepsy isn't just a sleep disorder. It's a window into how the brain works. It teaches us that the boundary between being awake, being asleep, and being in a dream isn't some solid, fixed line. It's actually a very delicate balance controlled by just a few chemicals. So the question I'll leave you with is this. How does that change the way we think about consciousness itself? I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.